Covered head to toe in protective gear, doctors work round the clock and compare the situation to a war zone. At some hospitals, emergency rooms and entire wards have been converted to intensive care units. Italian doctors have warnings for countries like Canada.
Your health system, no matter how good, how efficient, how modern it is, sooner or later will collapse because the number of patients is too high for the resources we have.
The situation is so bad, one specialist told local media they are overwhelmed and are having to choose who to treat. And in some cases, older patients may not get the same level of care, underscoring the crisis for a country with the second oldest population in the world, a population most vulnerable to the virus. The entire country is under lockdown. No public gatherings, no sporting events, and no travel. At train stations, police are checking paperwork. Only those with authorized work or family reasons are allowed to travel.
Yesterday, so she booked her ticket.
CBC News met Canadian Kate Andrews in Milan last month at the beginning of the outbreak. She is now under quarantine.
We're not worried about running out of food. The neighbors are great. There's people that are there to help us, but it is a weird feeling being completely dependent on the kindness of your neighbors.
In an attempt to control the spread, Italian grocery stores are only allowing a few people in at a time and keeping shoppers a safe distance apart.
When I was paying, they made sure that there was the right distance between one person and another.
All of this has grave economic consequences. In an effort to help Italians ride it out, the government is considering suspending taxes, mortgage payments, and bills, and will vote on those measures this week. Renee Filipponi, CBC News, London.
Thank you.
The game tonight has been postponed. You are all safe. And take your time in leaving the arena tonight and do so in an orderly fashion. Thank you for coming out tonight.